Well, happy Tuesday. It is September the 23rd in the year 2025, and welcome to another edition of Tuesdays with Tom. Well, last week I introduced those of you who have never been privy to the okey doke. I introduced you to the okey doke, and the okey doke method is a method of distraction. You say some stuff that really doesn't make a whole lot of sense, but it distracts away from what you want people to really look. In other words, you don't look over here if there's nothing going on, or who you're going to believe, yourself or your lying eyes. So stay alert and pay attention. The W or the WNBA is hot. They are on fire, actually. Well, for one thing, it's a good entertaining product, but an added component is it is hot with males, young boys to be exact. The W's fan base this season was 57% male and 43% female. The number of boys under 18 who watch WNBA games has grown by 130% over the past 4 years. Men have actually made up more than half the viewership for years. So Caitlin, you got Caitlin Carr, Angel Reese, Paige Beckers. The league is full of solid young stars. Those girls can hoop. It is on the rise, and it's only going to get better. And they're in the playoffs right now, and it's pretty exciting. Our G-list guest for today is Brandi Williamson. Brandi Williamson is an MBA and independent public health consultant, CEO and founder of Sankofa Synergy Consulting. She has over a decade of experience at the forefront of HIV/AIDS prevention, project management, and community advocacy. With an extensive background in public health leadership, Brandi has built a career dedicated to addressing health disparities through strategic initiatives, dynamic engagement, and culturally informed programming. Well, we look forward to that conversation. Our show today, of course, is brought to you by the consulting firm of Best Girl. Let's hear from Best Girl.
Best Girl is a consulting firm that provides customized leadership, access and inclusion, public relations, communications, and organizational consulting services. Clients include Fortune 500 companies, utilities, higher education institutions, small businesses, and associations. Best Girl's team of consultants, led by Joyce Gilly-Gossam, Emily Hedrick, and Sean Jones, partners with business and education clients to promote organizational effectiveness, communication, motivation, and leadership, with always an impact on the bottom line. Best Girl's customized consulting services include strategic planning, corporate communication, executive coaching, fundraising, and economic development.
Best Girl continues to customize the solution that fits your needs. I want to say good morning to Anthony Tedeschi and all the regulars who join us on Tuesday morning. It's good to have you. So let's go to our roundtable discussion. Barbara Wallace Edwards and Michael Walker. Good morning, Barbara Wallace Edwards. How are you doing?
Morning, Tom. I'm doing well. Thank you this morning.
Oh, I'm doing great. Is your computer cooperating this morning?
It's having a moment today. It's in and out, so hopefully it'll be working and doing fine for the entirety of the show today. We'll see.
Okay, what do you got for us this morning?
Well, Tom, I'll wait till Michael comes on to talk about the big elephant in the room, the Bruce Pearl retirement. But I wanted to talk about a good feel-good story. Billionaire philanthropist Mackenzie Scott, who's the former wife of Bezos, made $70 million in CF. One of the nation's private providers of scholarships to minorities who to raise $1 billion to strengthen all 37 of their institutions. So this is the second time she's used donation to HBCUs and UNCF. She made a $10 million donation in 2020. So I salute her. One of the things she said she wanted to do is strengthen diversity and inclusion across the country. So I truly salute her for that donation.
And who is that, Barbara? Because I didn't
Her
hear
name
the
is
part.
Mackenzie Scott. She's the former wife of Jeff Bezos.
Okay. Oh,
Yeah.
good. Good for her.
Yeah. So she said she wanted to donate over half of her money to nonprofit organizations that she felt are worthy of the work that they do. And so UNCF is one of those organizations she's chosen to support.
That's great.
Yes,
That's
it
great.
is.
I think your sound has cleared up a little bit. Good.
Okay.
Let's get Michael on. Michael Walker, good morning. How are you, buddy?
I'm doing well, TG. Good morning. Good morning, Barbara, to you as well.
So
How's everybody?
we're good, man. How's your world?
Good.
Oh, we're doing okay. It's funny. Barbara said she wanted to wait until I came on board. So let's just start and get right into it. How about those Auburn Tigers? Basketball has a new coach. His name is none other than Stephen Pearl.
And your thoughts?
Well, I guess the thing I read an article last night about it. I'm not surprised. We talked about it on the show that they were setting this up to pass it on to his son even before it came out. Tom, we and I talked about it. I felt that that's what Bruce was going to do. I was just surprised that it happened so quickly. And I mean, this time they didn't even fake it. Usually you do a national search and you announce the job and have people sit in, even if you already have it pegged to go somewhere else. But in this particular case, they didn't even do that. And in reading an article last night, they quoted, and sometimes journalists get things wrong, but they quoted the athletic director saying that 3 years ago when he came on, Bruce Pearl basically told him his coaching days were limited. And he said he started an internal national search to look for a coach. And the more they got into
national coach.
Yeah, that's the part I'm stuck on right there, Tom. I mean,
I wanted to make sure.
Internal national.
Yeah, I read it 2 times because my mind didn't quite compute at first, but I read it again and again. And then I called you, Tom, and I read it to you. So I did it 3 times. I think I kind of remember what it said. At least that's what was written. It said internal national search. So,
I hope they misquoted him, Michael. I really hope they misquoted him, but go ahead. I'm sorry.
Well, they probably did. But the bottom line is that they quoted the athletic director as saying, the more detail they got into it, they found out that the head coach was right there with Stephen Pearl. He was the one they were looking for.
Yeah.
So, I mean, that's pretty quick. And then a 5-year contract, and I just find it interesting that out of all of the players that have come through Auburn, has played in the NBA, and there's, I think, 1 or 2 on the staff, they didn't meet the qualifications for doing that.
Yeah.
Interesting. Yeah.
Well, their last name is not Pearl, Michael. So I'm sure Bruce had a lot to do with selecting the who would follow in his footsteps, and so it happened to be his son. And I mean, he may be a great coach. I don't know. I guess time will tell. But and Bruce is not really going anywhere. He's still at Auburn. I understand he's going to be in a special ambassador's role, assisting the athletic director. And I'm sure will probably still be heavily involved in coaching the basketball team, or and maybe not coaching, but advising the basketball team.
So he won't be running up and down that sideline.
No. Shouldn't be anyway. Again, time will tell. You don't ever know. It's all something new. We've not experienced this before, so who knows what it's going to actually entail.
Well, maybe we'll use a timeout sometime in the game when the momentum swings.
Oh man!
Yeah, you're right, Michael.
Big on those timeouts. I tell you.
We could have won a couple more games if the clock management had been used properly.
Well, let's talk a little football this morning.
Okay.
There's a couple things, and this is just an observation on my part. We're here in Atlanta, Georgia. You got the Falcons. You got Raheem Morris, head coach of the Atlanta Falcons. And I'm very happy that he has this opportunity, and I wish him the best. I really do. We also have a guy named Terry Fortenor, who is a GM, who happens to be African-American here in Atlanta. And that's great for the Atlanta Falcons in the city of Atlanta. But something that I find kind of interesting is last year they talked about the Falcons' defense, and they let go of the defensive coordinator, a guy by the name of Jimmy Lake, from what I understand. And I think he may have been an African American. I think he was, to be honest. I don't know. But they got some more defensive players in for this year. Okay. And Sunday, they go to the Panthers and got drilled by the Carolina Panthers, 30-0. Didn't even
Oh,
score.
wow.
Now, you see that in Pee Wee football. Sometimes you see it in high school. Very seldom you see it in college. But in the pros, 30-0, not even 3 points,
Yeah.
not one touchdown.
That's
And lo and behold, they made coaching changes yesterday. But the coaching change they made was very interesting. Ike Hilliard, who's a Florida Gator, played 12 years in the NFL, is coaching several places. He was the wide receiver coach. They fired him. Now, the quarterback threw 2 picks, I think, maybe a couple pick sixes.
mm-hmm.
I could tell by the way he was throwing the ball, it was being telegraphed. And I wasn't surprised when they got picked off. But they fired the wide receivers coach yesterday. Now, the offensive coordinator, guy by the name of Zach, they made a change with him too. They moved him from the press box down to the sideline, but he's the offensive coordinator, and they didn't score a point. Help me understand that, but you fire the brother who's the wide receiver coach. Come on, Raheem. Terry, what you doing, man?
Somebody had to do that, Michael. Maybe he was the newest man on the block. I don't
know.
Yeah,
That's
interesting.
That's interesting.
That
I guess he blamed the wide receiver coach for not scoring.
I mean, that just makes no sense to me.
I hear you. I don't know. Maybe it was something that had been brewing for a while.
Okay. And then the other thing, Auburn and Oklahoma. Let's just say hats off to the Auburn University football team, to the coaching staff.
Yeah.
I think that Auburn showed well, and there's no such thing as a moral victory. And I know that fans always blame the refs. Okay?
But in this case,
But in this case, and I'll be the first to admit, I've always said, and Tom, we used to say this a lot back in the day, it's us against the refs and the team we playing. Okay? When we walk out on the court, it was playing basketball. Okay, it's 5 against 7. Okay, or 5 against 8. It's us against them and the refs. And if you want to, you got to take the referees out of the game so they can't have any impact. But in this case, I think they had an impact,
Well, and I don't know if you can take them out of the game if we're talking about this play where the kid act like he was going out of bounds and he didn't, and he ended up catching a touchdown. And when he caught the touchdown, my first reaction was, well, how'd this guy get so wide open? There's nobody around him, And then we saw how he got so wide open. He faked like he was going off the field, and he didn't go off the field, which I don't know if that's a violation. I know it's not legal. I don't know if it's a penalty or a violation or what have you. But I'm really surprised once they reviewed it that they didn't change it.
Well, I don't know if they reviewed it during the game or not, to be honest with you. I think they called it. Yeah. And to answer your question, it is a violation. It's in the rule book that you can't use hideout or deceptive practices that involves hiding a player, especially when you're changing out or doing substitution. That is the illegal play. And here's the reason why I say I don't think they reviewed it is because Oklahoma coach is saying they talked to the refs about the play before they did it. So that tells you the refs were in on it then, okay? And it was a mistake by them.
Well, now, I don't know. I thought Auburn played well. And
well, let me ask you this then. What do you think should be done about it? Because the SEC came out and said it was an illegal play and further action will be taken. Well, what can they do? Are they going to take away the touchdown
You
and make
know,
it a tie?
I don't know that they can do anything now that it's passed and it's out. I don't know. That's my answer. Um, I just thought that, you know, they showed the kid walking off the field and nobody paid any attention to him because he was walking off the field. Yeah. But when he got to the sideline, he made a detour.
And ran down to the end zone.
Yeah. That was too bad. I felt bad for the kids. I felt bad for Coach Freeze because they really put a lot into it. And I thought they played well. I thought they played
What
really
about
well.
the touchdown they took off the board? The defensive touchdown.
Yeah. Yeah.
You know, the thing that bothers me about that play, and I have to agree with Freeze in his assessment, I saw this too. The player caught the ball, he bobbled the ball, but then he regained control beside his leg. And when they fell, it was ripped out. That's a fumble. How many times have you seen players catch? In the Super Bowl, we saw one player catch a ball upside his head.
Yeah.
Okay. Okay. And he fell down. They said it was a catch. So now let's look at this play on Saturday. He regained control by his leg, and the defensive back ripped it out, going out, picked it up, and ran it off. So they come back, and it was ruled on the field as a completion. So then they come back and say, well, it's incomplete, and they take the touchdown off. Now, my argument is if he had maintained control when he hit the ground with the ball on his leg, they would have called it a completion.
Mm-hmm.
Okay?
Mm-hmm.
So now how can you turn around and say because the man ripped it out and Auburn ran a touchdown back, it's an incompletion? You can't do that.
Yeah.
That's having it both ways.
Well, I think the team played well. I just feel like they got a couple of bad calls, and you know, I know that people have been giving Coach Freeze a hard time, but I thought the team played really well, and so we'll just have to go to the next game. Who we got? Texas A&M this week.
Yeah.
And I do think though that you know, last year we had a quarterback that we could not win with, and I think we can win with this kid, but I do think that an athlete, we need more of an athlete. We need more athletic play from the quarterback. Let me put it that way. A guy that can make plays, can make broken plays. You know, this young man who played hard. He plays hard. He doesn't break tackles. He can't fake people, and so on and so forth. And so you're asking him to run, but he's not a runner. So I don't know. Yeah, dude. And at some point, you know, you talked earlier about Coach Pearl's son getting a 5-year contract. So at some point, I don't know what Coach Freeze's contract is, but if we're looking into long term, we may want to let that young kid come in there and play some, and let him get used to it, and let him. You know, if we're looking long term, if we're looking 2, 3, 4 years down the road, then you got to let your young kid get some experience. That's just my thoughts.
Yeah. Well, I think Coach Freeze has a 5-year contract. This is his 3rd year. So
Okay.
I think that, you know, there's some urgency there. I won't say I'm not going to start anything, but I think, you know, there used to be that you could come in and coach and have a 5-year plan. Now it's been cut down to like 2 to 3 years, you know. So, yeah.
Probably 2.
Yeah.
And you know, and I think one of the things that perhaps spoiled long-term Auburn people is Coach Jordan was there 25 years. And then Pat Dye was there another, I don't know, what, 15 years or so. And so we got used to that. And I don't know how long Tuberville was there. He was there for a good little while.
At least 10. Yeah.
Yeah. And then was it Malzahn after that?
Yeah.
And he was there what?
About 8 years.
Yeah. Yeah, maybe. So I think we got used to that. And we put a lot of pressure on those coaches. And to find a solution right now, and, whether that's fair or not, who knows? And, they get paid, compensated well, so I guess that's one thing that people look at, and so we'll see. What else you got, Michael? Anything? Barbara's having trouble, I think. She's in and out.
Yeah, she's having a few problems. Have you heard of the company called Pagonia? It's like it's this outdoor place. It's this guy, he builds a lot of hiking and that type of stuff. And he is what it is, Patagonia.
Patagonia, yeah, I've heard of Patagonia, yeah.
Yeah, Patagonia. That's what the guy that started that company, he's a billionaire. And he said that the day he became a billionaire and joined the club was the worst day of his life, one of the worst days of his life, because Forbes compiled this list of billionaires and stuff and put him in there. And he felt like, he said it pissed him off. That's not what needs to be done. And the way he looks at it is, it tells him that the policies in the U.S. do not work, where you got a few people over here that are ultra rich and all the other people over here are poor. It's something with the policies that's going on. And this guy, he's been a lifelong rock climber. He spent years sleeping in his car or on dirt floors in the wilderness, surviving on just $1 a day and eating dented cans of cat food as he was trying to build his business. And what he decided, and he's 86 years old, he and his company, they decided that they were going to create a trust. And they donated the company to the trust, and $100 million a year that they donated to cleaning up the climate and these nonprofits that he says is actually making a difference, that's where he wants his money to go to.
Great, man.
So
wonderful.
That's kind of dovetailing off of what Barbara said earlier about Jeff Bezos' wife. When you look at people like this, and then you look at the okie dokie in chief trying to get rid of programs that help people that are disadvantaged, regardless of whether it's physical, mental, or whatever. You see these people that are stepping up and trying to do the right thing. So that does give you some hope in humanity.
I agree. And I think there are more, well, hopefully there are more of those than there are the okie doke chief. I don't know. The guy just, one of my friends lives down the street from me, and we walk on Sunday mornings. And so this Sunday we went over to the beach and walked about a mile down to the pier and then a mile back. And he had been out of town, and so I didn't notice anything different about him or what have you. And then we were walking, and he had his cap on backwards, but I never paid any attention to it because I wear a cap sometimes, and I wear different caps. I got a lot of different caps, and we passed by these people, and this guy said, "Oh, that's a great hat, man." And so I looked and I noticed that cap, and it was a MAGA cap. And now we've had these discussions before, and so he got in front of me after the guy said, "Nice cap," and now I could see the cap because I hadn't paid any attention to it. I never said a word. I never noticed the cap. I never said anything to him about it. That's his cap. If you want to be recognized as that, that's your problem. It's not my problem, you know? And I wasn't going, and we've had this conversation. He's a Republican guy. I'm a no party. And he talked about how he didn't like Trump because of just some of the negative things he says from time to time. And he says, well, he doesn't have to say those things, so on and so forth. And that was way back during his first term. But I just found it interesting that he would have this cap. He goes out of town and he comes back and he's got this cap on. And he walking right in front of me so I could see it. And I just said to myself, I'm not going to say a word. It ain't on my head. And it don't reflect on me, you know. I thought that was really funny, and he's a great guy. And so it was like, you know, I'm not even going there with him this morning, you know.
Smart move.
I'll just pull the okie doke on him and won't say a word.
Smart move. Smart move.
Yeah, that is smart. But Tom, you know, you talk about that. It's almost like there's a third party now. There's a MAGA party, the Republican Party, and then the Democratic. Of course, it's independents as well. But I think the MAGAs are like a totally new party. They have a totally different way of thinking than just a true Republican. And you know, they haven't acknowledged it as such, but I think it is different from the Republican Party.
Well, and I know we need to move on. But what do you think about just quickly Jimmy Kimmel being brought back onto the air? any comments?
He's coming back.
I'm
glad he's coming
happy
back.
that I'm happy he's coming back. Yeah, I think it was the wrong call in the first place, but I'm happy that it's been reversed.
Well, and I never, and you know, maybe I'm missing it some kind of way, but from what I heard him say, the MAGA people were thinking it was a left-wing person that shot Charlie Kirk, and then it turned out being one of them.
Right.
I guess I'm still trying to figure out why everybody got so upset over that.
Right. Exactly.
You know, and you can't say stuff like that, so on and so forth. And I mean, people lost their jobs,
right,
over that.
Right.
I don't get it. So we'll see.
You're like the rest of us. None of us get that.
All right. Well, let's go to Sean. She's got a minute for us, and then we'll go to our G-list guest. Good morning, Sean.
Good morning to everyone joining in with us. My name is Shantia Jones, and this has Got a Minute. It is officially fall, and I can tell the difference already. Cooler mornings, comfortable evenings, and rain showers? Anywho, let me tell you what's happening this week. Well, this week in 1960, for the first time in U.S. history, a debate between major party presidential candidates is broadcast on live television. The presidential hopefuls, John F. Kennedy, a Democrat senator out of Massachusetts, and Richard M. Nixon, the vice president of the United States, meet in a Chicago studio to discuss U.S. domestic matters. Kennedy emerged the apparent winner for this first of 4 televised debates, partly owing to his greater ease before the camera than Nixon, who, unlike Kennedy, seemed nervous and declined to wear makeup. Nixon fared better in the second and third debates, and on October 21st, the candidates met to discuss foreign affairs in their 4th and final debate. Less than 3 weeks later, on November 8th, Kennedy won 49.7% of the popular vote in one of the closest presidential elections in U.S. history, surpassing by a friction the 49.6% received by his Republican opponent. Thank you all for joining in. My name is Shantia Jones, and this is Got a Minute.
John. So let's go to our G-list guest this morning. And our G-list guest, is Brandi Williamson. She's an independent public health consultant. She's CEO and founder of Sankofa Synergy Consulting, LLC. Good morning, Brandi. How are you?
I am great. Good morning.
All right. Thanks for being with us this morning.
Thank you.
So we're looking forward to. Tell us a little bit about Sankofa and its Synergy Consulting.
Well, it's a business that I founded just because I know I love my community. I am all about community togetherness and education, really focusing on social determinants of health, HIV prevention, and a lot of that. We just needed more focus on it here in Jacksonville, Florida. Times are changing. A lot of history is being removed. And I just wanted my company to be able to speak clearly and loudly on different things that were affecting Black and Brown communities that may not have access, equitable access to different things. So I wanted to be that catalyst to bring that to our community, to also be a change agent to bring other organizations together. So putting on collaborative events for different zip codes in our community that may not have access. I wanted my organization to be able to bring that to Jacksonville.
Okay. Barbara, can you ask a question?
I think so. I think you all can hear me. Hopefully.
Okay, we hear you pretty good.
Good. Good morning, Brandi. Thank you so much for joining us this morning. I wanted to ask you about Friends of the Quilt. I understand that you're a board member of that organization. Tell us about that and how are they involved in the community?
Well, Friends of the Quilt is an amazing organization, and what they do, have you ever heard of the AIDS Memorial Quilt? Or have you ever seen it? Okay, so basically it's a local. Oh, okay. Well, it's a local chapter here in Jacksonville, Florida. And what they do is every year they go to California and they actually pick up these huge AIDS memorial quilts that were developed by friends or family members of those who have died from AIDS-related complications. And so if you remember in the 80s and 90s, these quilts were being made and there's pictures on them, there's quotes on them, just different things to memorialize those people. And what we do with the local chapter is we bring them here, and December 1st of every year, which is World AIDS Day, we have a ceremony at our courthouse, and we also ship those out to different parts of Florida where people can hang them to memorialize those individuals. So this year we are specifically focusing on women and children. So that's what we'll have up. You can go on the website, AIDS Memorial Quilt website, and you can actually look at different quilts over the decades. Someone that we know, Kathy Advocate, she did not die from age-related complications, but intimate partner violence. She was living with HIV, but she will have a quilt made. So we developed that quilt, and it already has a number. So anytime that we want to look at it, we can go on the website and look at it.
Wow, that's great.
Brandi, I got a question for you. You talked about the 80s and the 90s, and I mean, and HIV/AIDS was a big thing then. It was publicized. It was, we had watch out for it and so on and so forth. Is it as big a thing now? And I haven't heard as much, so that's probably why I'm asking. But is it as big's not the right word, but I don't know the right word to use here.
HIV is still an epidemic.
Okay.
HIV is very much still an epidemic.
Okay.
If you remember, I'm too young to remember back in those days, but but if you remember, people were diagnosed with HIV and AIDS and were dying very quickly.
Yes.
So what benefited this community is that you had parents, you had our trans community, you had our gay community who were marching on Capitol Hill saying, you will save us, you will give us meds, we are going to survive this, you're going to have to say HIV publicly. What I will say is, as HIV and AIDS has affected different communities, the conversation has went underground. So especially with Black and Brown communities, because of stigma, we don't talk about it as openly. So, I've tried to work with a lot of different faith-based organizations. And the reply I get back a lot of times is, we don't want to talk about that. That's them. That's not us. And so I say, you may have someone in your church who's living with HIV, and when you don't discuss it, that's not giving them a safe place to talk to you or anyone else about it. Or because of the stigma, we say, oh, that's a gay disease, I don't have to worry about that. The other thing is, I hear a lot of people say, is the commercials, the advertisements, the billboards don't show me. They show gay, Black and Hispanic men. They don't show me. But HIV affects anyone. Some of our highest populations are Black heterosexual women and our older adults. So a lot of people think, oh, we don't have to worry about our older adults 50 plus. But yes, you do. So just because you hit that 50 benchmark doesn't mean you're no longer sexually active. You're no longer human. So that's why we have to keep the conversation going. Where we live, work, play, and worship, we should be talking about HIV prevention and staying in care if you are living with HIV.
And apparently, you mentioned earlier, people were diagnosed and then bam, they died shortly thereafter or what have you. Apparently that's not the case. There's a way to prolong it, I guess, or there's medication. Now,
absolutely.
Because I remember when Magic Johnson came out, man, that was huge.
Yeah.
That was huge. And, so it was just maybe a different time. Michael, you got some comments?
Well, I do. And thank you, Brandi, for being with us. And it was kind of going to be similar to what Tom was asking. And part of it was, and I think you've answered it, but I just want to be clear. We don't hear as much about AIDS anymore. So is that because people are not spending the money for awareness on it? Or is it something where they're just trying to forget about it? And then the back part of my question was going to be, when it came out, there were all these rumors and innuendos about where it originated from. It was in a lab that was created to get rid of people of darker skin. It was a result of a guy out in the jungle having intimacy relationships with a monkey. All this stuff. What's the real truth?
So you have a lot of questions. So what I will say is, for your first part, HIV is not talked about enough for a lot of reasons. So we know that federally, HIV prevention funds are being cut. So that goes directly into what local organizations can do. So that goes into our ability to purchase HIV test kits, to purchase condoms, to have media campaigns. So when they cut those funds, it makes it harder for us to get the word out. Also, it's because of the stigma. So if I don't want to hear about HIV, or if I have this misinformation that HIV only affects this community, so no, I don't want to hear about it. And then we also have to be honest about the medical distrust or mistrust in our communities. So when we look at things throughout our history as African Americans and what has happened to us over the centuries, hey, I don't trust medicine. I don't want to talk about it. I don't want to get tested. I think that HIV was created to wipe out African Americans. Those are valid, reasons why people don't want to talk about it, but we have to, because what happens is people get into these communities and it has been studied that, hey, I only have sex with this certain amount of people. because I don't want to contract HIV, but all it takes is one person to have an outside partner, and then they can bring HIV back into that community. And also with HIV, as you were saying, Mr. Gossam, people are living a lot longer because of the advancements of medication. So if they're taking their meds, if they're staying in care, they get to what we call undetectable. U equals U. Undetectable equals untransmittable per CDC, meaning their viral load is so low that they can no longer transmit the virus to anyone else. So education and prevention is not just for those who are not living with HIV, it's for those who are also living with HIV, because we want you to remain healthy. So the other part of it is understanding how HIV is transmitted. A lot of people just think, oh, it's just through unprotected sex, but there's injection drug use. There's mom to baby through breast milk. Vaginal secretion, semen also transmit HIV. So we have to talk about all of those things. So our biggest thing is, if we have a pregnant person, we're also asking them, making sure that throughout their pregnancy, they're getting tested. What I hear a lot from men is, oh, my wife, my baby mama, my so-and-so just had a baby. My baby's negative for HIV. That means I'm negative. That's not necessarily true. So it's understanding the transmission. HIV is a virus. It's not transmitted from mosquito bites, from dogs, from animals, anything like that. It's human to human transmission. So like I said, there are different ways of transmitting the virus. It's making sure that we take responsibility for ourselves. So making sure that you get tested at least once a year, you get tested, and knowing your partner status. So not just having them come out of a clinic or off a mobile unit saying, oh, I'm good, I'm clean, I'm negative, but actually looking at the paperwork that says your HIV status is negative. Or if you're living with HIV, you're at undetectable levels. So, and really quickly, we have something called PrEP. So if my partner's HIV positive and I'm negative, I would take this medication to remain negative. So it's either injectables or a daily medication that I would take to prevent from getting HIV. So there are so many advancements in medication. We just have to be open to it and to learn more about it.
I think too, back then, what was that, 30 years? It's only 30 years ago though, really, in the 90s. Mm-hmm. Being gay wasn't as open as it is now. Being gay wasn't cool. And so if you were gay and you were HIV, then I have a couple of friends who died from this, then, they wanted to keep it undercover. And it's like, but no, you got to get treated, man. You can't, well, I don't want anybody to know I'm gay. Shit, I know it, and most of the people who know you know it. They just don't say anything to you, And so it's the world has changed in about 30 years in terms of we're more open about people being gay. I think we're more open about who's HIV, and we got commercials on television now. So I think things have changed, and hopefully for the better.
In some ways, I will say it has changed. So if we think of races, to be openly gay for white Americans is easier when they come out and share their story. That's very different in Black and brown communities to come out as being gay, because we have our church, we have our family, it's a lot of different things. Once you say you're gay, people unfortunately assume they combine being gay with HIV. If you're gay, one has to go with the other, and that's not true. So even though we've made a lot of advancements, there are a lot of people who still are not open about their sexuality because of fear, because of stigma, and also and the same thing is with HIV. They may want to speak on it, but it's fear, because if I don't tell anyone, then no one can judge me for it. And there's stigma sometimes even with our physicians, with the quality of care that people receive. So it's not just the community, it's a institutional level that we also have to think about. It's from anybody we talk to, is educating them. Everybody is part of the solution of getting to zero, of ending the HIV epidemic. So that's why we have to educate everyone. So that's our physicians, that's our teachers, that's our police officers, that's everybody we come in contact. They should know the good factual information about HIV prevention and awareness. And that's how we will get to zero. But as long as people hold on to that stigma and that separatism of them, that's them. I don't have to worry about that. I've met plenty of married people who acquired HIV throughout their marriage because one person stepped out, or it could have been injection drug use. So again, that's why you have to get tested. And especially with our younger people who are like, my man, he's my man, but not my man. You know, we're in that, we're in an unofficial relationship. And so when it's unofficial, there's no communication there's no outside sexual partners. So it's not just sex, it's behavior. What behaviors may put us at risk for acquiring HIV and understanding that.
Michael, you got anything else?
Yes, Brandi, I want to go back to you speaking about the medication, and the example you gave was a couple, and one has contracted HIV and the other one doesn't. And so the one that it does not have it takes a medication to keep them from getting it. My question to you is, this particular medication, help me understand why, if it will keep someone from getting it, why is it not widely available on the market for people to take or get for the prevention?
Well, it actually is. It actually is. It actually is. It really is. So it's our level of awareness. So there's commercials about PrEP medication. You may see them. But again, if the PrEP commercials show trans women and gay, Black, and Hispanic men, you're not looking at that because that's not how I identify. So that passes right over you. So those medications are available. They're on our formularies, and they with ViiV and Gilead Sciences and ViiV Healthcare, they have something called Patient Assistance Program. So let's say your health insurance may not cover all of the cost of the medication. That patient assistance program comes into play, where they will keep your costs low or at no cost, so you can take this medication. Some of our jobs, our insurances will pay for it. We'll pay for all of it. So it is widely available. It's about knowledge. It's about awareness that I can take this medication. But then again, there's that stigma of why are you taking it? And some people have found stigma even with their healthcare providers. Why do you need to take it? That's not for you. You're not gay. You're not this. You're not that. So again, it's us seeking factual information about PrEP. And again, it's knowing my behaviors and, should I be on PrEP? And if I am in a relationship where I call a magnet relationship, one person is positive, the other person is not living with HIV, yes, take PrEP. If I am not in a committed relationship, there's nothing wrong with that. And I have one or more sexual partners, talk to your doctor about PrEP. But our doctor should also be asking us those questions, those sexual health questions. And unfortunately, even in 2025, sex is still such a taboo subject. And we're sexual beings. That's what we are. So we should be comfortable talking about it.
So you would have to go to your primary care physician and ask them to give you a prescription for PrEP, then, is what I'm hearing you say. Okay.
So you can go to your primary care physician and talk to them about PrEP. If your provider is not fully aware about PrEP, you can always go on ViiV Healthcare or Gilead Sciences to learn more about PrEP. There are local community-based organizations who may also offer PrEP. You come in, you get tested for HIV, and you have that discussion. You have PrEP navigators who will assist you in getting on PrEP. So again, it's either daily medications or it could be a twice-a-year injection that you take that will help prevent you from acquiring HIV. But I do want to say that does not prevent other STIs. So gonorrhea, chlamydia, syphilis. So it's also knowing that, again, the full understanding of it. But taking PrEP is a first step in ending the HIV epidemic. Taking PrEP, using some type of barrier method, talking openly to your partners about their sexual activity, all their behaviors that they have, and being honest with yourself is part of it.
What's the price range of PrEP? Do you know? generally? What it usually?
Thousands.
Thousands?
It's thousands. It's pharmaceutical. So, everybody's got to make money. So that's why they have that patient assistance program and then different insurances. So, some people say, oh, I can't afford it. I can't afford to be on HIV meds. It's too expensive. You have Ryan White. Ryan White program is a payer of last resort. So those living with HIV, that will help pay for their meds. That will help pay for mental health counseling, substance use. A lot of different things come into play. So if you're not living with HIV, you have patient assistance program. Just come in. The first step is come in, get tested, talk to your primary care physician, talk to someone, a community health worker. I'm interested in PrEP, and we can link you to that. But the thing is, you have to come in.
Okay.
One of the questions came from the audience that says, is the medication expensive? I think you've answered that, but they also ask, can you use it with Medicare or Medicaid?
I believe you can. So I don't want to get too far in the weeds. Okay. But what I would say is come in and let a PrEP navigator assist you. When they do that patient assistance program, they can walk you through all of that. So they'll help you get access. So organizations, they may even have funds that if you can't pay for it, our organization will pay for it directly for you. So just come in. The first step is getting tested.
Okay, and we've got people all over the country.
All over.
And so they need to go into their physician.
Go see your physician. So we have mobile testing units that are in our communities that do free HIV testing. Get on those mobile testing units. Go to your primary care physician, your OBGYN, any doctor that you're seeing, and they can make that referral. Your local health department. Come into your local health department. The first step is we have to know your HIV status. So come in, get tested, and then we can link you to the next steps. First step is you got to come in.
Okay. Michael, Barbara, anything else? Or Brandi, you got anything else you want to add?
Well, one, again, thank you for this opportunity. I know talking about HIV prevention and awareness is a heavy topic, so I definitely appreciate it. But I tell people to stay away from Dr. Google when they're looking for signs and symptoms of HIV. Go to cdc.gov. You can go to aidsview.org. The first thing with ending the HIV epidemic is to get tested, know your status. And if you are living with HIV, please stay in care. Make sure that you're talking about HIV prevention where you live, work, play, and worship. If you don't have someone you trust in the community, talk to your primary care physician. Even in your ER, if you don't have health insurance, talk to that doctor about how you can get access to care, things such as that. Again, I thank you. And I just want to make a quick plug. Here in Jacksonville, Florida, on October 11th, I'm partnering with a local restaurant. We're going to have a breast cancer walk on October 11th. The owner of Annie Lee's Bakery and Diner, she is a breast cancer survivor. So we're having a free breast cancer walk, and we would love to have vendors and people to come out. And again, prevention is prevention. Whether it's breast cancer, HIV, you gotta get that checkup. So that's what we're doing October 11th.
Thank you so much. That's great. It's great information. Michael, you were going to say something?
Yes, Brandi, I wanted to ask you a question. With your consulting company, and notice in your background, you've done work with the community health and then public health. Tell us, what's the difference between community health and public health?
So what I would say is, we're talking about public health. We're talking like macro level public health. So this affects everyone globally, nationally, statewide. When I'm focusing on community health, I'm focusing on my local community. So what's around me. So when I'm out putting on events or curating events, I'm doing assessments of the community needs assessment of what this community directly needs. So what's happening in the zip codes that I'm targeting, what we call here locally Health Zone 1, is very different than what the state needs. So where I'm at, We have low social determinants of health, low literacy. So these are things that I have to take into account when we put on specific events of what's needed. Access. Public health is very large, because public health can be technology. Public health is epidemiology. Public health is so many things. So it's macro, micro.
Thank you.
So, Brandi, let me put this information out. You are available for keynote speaking engagements, panel discussions, consulting, and community advocacy collaboration. So you're available for all those things. Is that outside of Jacksonville as well?
Yes, absolutely. Okay. I am available. I love health. I love helping our community. So wherever that is, I am definitely available. I was just in New Orleans at a Fast Track City Summit. And that was a few days of learning from other people who are in the same field. So really quickly, Jacksonville was designated as a fast track city by Mayor Donna Deegan, September 18th of 2024. So she signed a Paris Declaration saying that she is on board with getting Jacksonville to 0 new positives by 2030. So our mayor is on board. We're the 4th city in the state of Florida who has made this designation. So yeah, I am fully on board with HIV prevention. Not just that, but just equity for everything. Especially our Black and brown communities. We need it the most.
Thank you so much. We appreciate having you. It's been great. Thanks.
Thank you.
Okay. All right. Okay. Well, let's move on to our closing comments for today, or as I see it. And I want to thank Brandi for that. It's really good information, and hopefully will help somebody. So our closing comment for today, or as I see it, I want to say hello to my friend Pat Addington over in Mobile. I heard some information about her yesterday, and hopefully she's doing okay. I want to talk about James Owens' book, The Story of Integration of the Southeastern Conference, and Owens, who's the first Black football player at Auburn. Books written by myself, Sam Hayes, with an afterwards by Gloria Owens. Books available in paperback and hard copy. It's available at Amazon. You can get a signed copy at bestgirl.com, which is our website, or at emilybestgirl.com. She'll be able to get you a signed copy and get it back to you. Owens was the first African-American football player at Auburn University and one of the first in the Southeastern Conference. And I think that's what really the book's about, is that level of involvement from people who were involved throughout the conference. So we wish you a great today. But that's our show for today. We want to thank the audience. We appreciate you. Thank our G-List guests. Thank our sponsor, Best Girl Inc. Thanks again to TWT team of Barbara, Sean, Emily, Michael, and Joyce. And that's it for this September the 23rd in the year 2025. Remember, a day without a smile is a day wasted. Enjoy yourself. Make every day count. Stay safe. Blessings and peace.